Hi all, welcome to this evening's Creating Careers. We hope you've joined us for some before, but if not, we'll just quickly go through some housekeeping. If you could please ensure your cameras and microphones are turned off, that helps us with the bandwidth. And you can ask any questions, or if you need to communicate anything, let us know of any problems. There is a chat box for you, which you'll be able to see either at the top of your screen or just to the right-hand side, depending on how your screen is set up. The session is being recorded, so you'll be able to watch it back. So you don't need to worry about making any notes or anything like that. You'll be able to do that using the on-demand resource. This is a rough kind of rundown of what we're going to do today. So we're going to pass over in a second to my colleague Leslie Ann, who is going to run the interactive session, and then you'll hear from two of our NHS professionals. At the end, you'll have an opportunity to ask any last minute questions you've got, so do please pop those all in the chat. And you'll also be able to hear about the next steps, where you can get additional support and what else the Creating Careers programme can offer you. Okay, although our event is Northwest wide, so we have students and staff joining us from across the whole Northwest, you will get specific support for your local opportunities and your choices and your questions through your local UniConnect partnership. Whichever area you're in the Northwest, you will have one of us here to support you, and you can see the names of our different partnerships on there. Okay, just to flag very quickly, you will have seen this in your invitation email for this afternoon. Running alongside the live webinars, we do have a Google Classroom. That's an online virtual learning environment. And the idea of that is we post all the resources that you need, everything that you might want to get further information, signposting, other opportunities, different things that are going on. That's all posted in there. So we do really strongly encourage you to join it. You'll have had the first set of instructions in your email from my colleague Abby, but we'll also pop them in the chat now. If you would like to join, you can see the class code, and then you do have the opportunity to ask extra questions on there if you kind of go away and have extra questions after the webinar or after you do a little bit of further research as well. Okay, at this point I will hand over to my colleague Leslie Ann, who's going to look after our interactive session.
Thank you, Sarah. Would you, I've got access to share, you're one step ahead of me. Thank you very much. I'll just share my screen. So we've got the resources up that we need for today's session. Brilliant. So for those who've never been to Creating Careers before, hopefully a lot of you have, as Sarah said earlier, but for those who haven't, we've got pre-work before every webinar, and that's to ensure that you're as prepared as possible so you can ask thoughtful questions and take the most away from the session that you possibly can. Now, we want you to have feedback on that pre-work, so we start every Creating Careers with a pre-work quiz based on the topic of the webinar. So today we're going to do a little interactive quiz on diagnostic and therapeutic radiography based on that pre-work that we did. I really hugely encourage you to get as involved as possible. We are not keeping scores. We are not tracking people's answers. You know, your cameras are off, your mics are off, so no one, you know, is monitoring where you're up to. This is for your own knowledge. And the more you get involved, the more you get out of it, and the more it helps other people with their own knowledge. So please, please get as involved as possible. Okay. So for your pre-work, I gave you some links to both of those roles, and I asked you to think about comparing the roles. What is similar? You'll find there are a lot of similarities, and what is different. So you've got a really sound understanding of those two roles before coming into this topic, to this session. So how we're going to start it is, we're going to think, right, we've been tasked by NHS Jobs. NHS Jobs is the website that any NHS worker will go on to find their current vacancies. So we've been tasked by NHS Jobs to create a job description for both a diagnostic radiographer and a therapeutic radiographer. Okay, so you can see down the side, these two screenshots are actual job descriptions that are live at the moment on NHS Jobs. We've got one for a diagnostic radiographer, which is at Clatterbridge, which is in Liverpool. And we've also got one for a therapeutic radiographer, which is in Lancashire. And you can see that one's got a few extra responsibilities on it about staff training and things. So we are going to create our own one together now, and hopefully you're going to help me loads to make sure we get that done. So the first thing we're going to look at is a job summary. If you look back at those advertisements, you'll see the first thing it pretty much says is job summary. So I've had a little go at starting a job summary. I'd like you to help me finish them off. So I want you to complete my sentence. So after I've read out the sentence and the options, you'll get a Zoom poll come up on your screen. I want you to choose which words you think are missing from our job summary. So diagnostic radiography. As a diagnostic radiographer, you'll use cutting edge blank to take images of the insides of patients to help understand and blank conditions. What are the two missing words for our job summary? A, tools, treat. B, materials, monitor. Or C, are the two missing words, technology and diagnose. So the poll is going to pop up on your screen. Can you click which two words do you think make the most sense? Some of them you may think still fit in, but which words do you think would be best to include in our job summary for NHS jobs? Put your answer in, okay. Wonderful. So the majority of you are going with C, technology and diagnose. Absolutely fantastic. So they use cutting edge technology to take images and help understand and diagnose conditions. The clue is in the title there, isn't it? So just to finish off our summary for diagnostic radiography, let's move on to our next slide. Oh, I'm giving you the answer there. Based in a hospital, you'll work with patients and colleagues to design blank programs and support patients with until their treatment blank. So is it suitable and begins? Is it B, treatment ends? Or is it C, care works? Which two words make the most sense to you? What should we put on our job summary? Just wait for the results to come in. Wonderful, 90% are going there. Treatment ends, fantastic. Brilliant. So that is correct. So you're based in a hospital, you design and treatment programs, and you work with them until the treatment ends, not begins, not works, ends. Okay. So just as a summary, diagnostic radiographer, you're using cutting edge technology to take images of patients and help diagnose and understand conditions. You're in a hospital, you'll design treatment programs and you'll support patients until the treatment ends. You use things like CT scanners, 3D images for surgeons to prepare a patient for an MRI scan. All that technology and all that machinery, I'm sure our volunteers will be able to tell you loads of interesting stuff about them. But you'll be using the most complex and advanced technology. So you're also central to wider teams and you'll work with lots of different colleagues across lots of different departments. So that's wonderful. We've got our first job summary done for our job spec. So next one, I've been a bit kinder this time and just given you one blank. So we're going to go on to therapeutic radiography. As a therapeutic radiographer, you'll be part of a team helping people who are dealing with blank. Is it A, cancer, B, disease, C, arthritis? What should go in our job summary? Put your answers in and we'll see. Fantastic. Correct. The answer is A, helping people who are dealing with cancer. So let's just finish off our job summary. So for a therapeutic radiography, from taking an initial blank to using a CT scanner or linear accelerator, I'll let the experts explain that one, you'll use some of the most complex and advanced technologies to treat blank. Is it A, X-ray and tumours? Is it B, consultation and patients? Or is it C, image and illness? Put your answers in the chat. Let's see. Okay, oh, a bit more mix there. I like that. I like to trick a few people. So the answer is actually A. So you take an initial X-rays, you're using CT scanners, and you'll use complex and advanced technology to treat tumours. So obviously this role is all about treating cancer. So to summarise, you're helping people with cancer, you're taking X-rays, you're treating tumours. And again, this same bottom paragraph, just very similar to diagnostic radiography. You are working in a wider team, consulting with colleagues across various different departments. So we've got our 2 job role summaries to go on our job spec. And just to make it clear, as I asked you to look at the pre-work, there are loads of similarities between those 2 roles, and we will see them again in the later part of this session. But there are differences. And just to make it very, very simple, I know our volunteers can probably tell you a lot more than I can about this, but diagnostic radiographers, they're using imagery and technology to diagnose, see how the body is responding to treatment of a variety of illnesses. That could be something like heart disease, whereas in therapeutic radiography, they're using technology in the treatment of cancer. Okay, so that's a very simplified way to look at it. Okay, so the next point in our job spec is we know what our role summary is. Now, usually a job spec might have something like working hours, pensions, pay. We'll leave all that to create HR to put into that job spec. But I want us today to think about what are we going to put. There's always a person specification. What kind of person do they want? What kinds of skills are they looking for? So by skills, I'm thinking about your ability to do something really well that helps you carry out your job. That's what we're looking at. Think about a footballer. Think if you're a striker, you've got really brilliant shooting skills, or you might need a bit of defensive skills to help the team, okay? And work under different conditions. If anyone watched the African nations on Sunday, you would have seen Sadio Mane. His penalty taking skills early on in the match weren't that great. He missed a penalty for his country, and then he was under immense pressure, and then had to take the last penalty kick to win the tournament for his whole country, who'd never won it before. The pressure was on him. I mean, he was hiding behind the players as the whole shootout was going on, and he stepped up and he took it and he scored. So he showed his shooting skills under immense pressure. So that's the kind of thing we are thinking about. We're transferring it to these 2 jobs. What are the skills that people would need to be a diagnostic, working diagnostic radiography, and the same therapeutic, and we'll see a lot of them cross over. So what I'd like you to do is, I'm just going to come off share screen, and we're going to go a little bit live now, and I'm going to ask you in the chat to tell me, what skills should I now put in this job spec? Help me out. What skills? Think of all the different skills you might need in a job, and get that chat on fire for me, please. What skills should I be putting here? And you'll probably think some of them may go in both. But what skills should we put in? So I can see things are coming up straight away. I absolutely love it. Thank you very much. So we have got communicate. Let's get that in. Could I ask a favour from either Abby or Sarah as I'm writing? Could you just tell me what's coming up in the chat? So we've got communication skills, right? So that's obviously going to be our first one. What I would really, really like for you to do, I'd say that definitely. Could you tell me why? If you're doing an application or an exam, just putting the answer down isn't enough. You need to say why to get most of your marks. So why is communication really important to these roles? Have a think about, who are they working with? Why do they need to communicate? Can anyone just give me a little bit of an example of why the diagnostic or therapeutic radiographer need communication skills? Who are they working with? Come on, I know you know the answer. Okay, fantastic. So making people feel comfortable. By people, who are they working with? That's absolutely brilliantly along the right lines. Making people feel comfortable. That's why you're going to need your communication skills, because they're in tricky situations. But who are they working with in particular? Come on, I know you're all there. You've already put some answers in. Communication to get fantastic. Communication to get information to patients and doctors, other colleagues. Fantastic. So we'll put patients and colleagues in there. Everyone's having to see me type. I'm working under pressure. This is a skill for me, having to type with other people watching me, because I can't do it that way. Okay, fantastic. So we've got communication down, right? So we've got another one. Brilliant, Kate, with an example attached to it. That's what I love to see. You're helping me out massively there. So we've got problem solving in order to figure out best treatment plans for people. And you've tagged that to therapeutic. So that's brilliant, problem solving. We'll put that in. And I think our diagnostic volunteers would agree that problem solving probably come under both. So what else have we got coming up? Let's have a little bit look further up in the chat. Okay. I'm just scrolling up to see. Right, we've got loads of brilliant things. Attention to detail. That is a brilliant one. Thank you so much. Let's put attention to detail in there. Anyone going to tell me why you need attention to detail? Anyone? Okay, fantastic. So we've got in the chat attention to detail to find the smallest irregularities in diagnostic. And I think, again, that could go over to therapeutic radiography. Anything else that we can add to our job spec at all? Okay, so we've got our problem solving, we've got being caring, attention to detail. Anything else? We've got communication skills. We've got, okay, so we've got from Layla, we've got working with other medical staff. So again, that's brilliant. What kind of skill could we put that under? Working with other medical staff. How would you describe that skill? If you were writing a job spec, what do you think? How do you think they'd phrase that job skill? Working with other medical staff. Fantastic, Kate. Wonderful teamwork. I love it. Thank you so much. So teamwork skills, and obviously they go under both, but I'm just being lazy now rather than writing it in both. I can't emphasize it enough how it goes under both sections. Right, so thank you so much for that. There are loads more, and I'm going to talk them through with you now. So I actually went on those at the beginning when I posted those screenshots of those live vacancies. I actually had a look at the job specs of them and what the key skills that they are asking for. And I've put them here to share with you. So we've got loads of them ourselves because you guys are quite smart and obviously doing your pre-work. So diagnostic, these are actually what were coming up on the NHS job site. So obviously communication, you're working with staff and patients. You need to make sure that they listen, that people understand what you're trying to tell them and that you listen to people. Analytical and judgment skills. So you're using test results to inform patient treatment plans. So you need to look at results and think, right, analyze them, read them correctly, and then make a judgment to say, right, this is how, or decision making, this is how we're going to go forward. Technological skills. You're obviously using loads of like wizardry, almost all these amazing machinery that you're going to have an interest in new technology, and not only that, be very safety conscious on how you use the technology. Observational, attention to detail, we've already had that one, so that was brilliant. So you've caught some of that coming up. And planning and organisational, you've got to plan treatment programmes, you've got to adapt plan schedules. There might be a schedule that you've got to treat someone and an emergency might happen, so you might have to adapt that. Training other staff, so planning that training and ensuring that your department is clean, totally clean for you to proceed in your job. Now, loads of those will go over to therapeutic, okay? And I've put communication at the top of this one because it's just so important to everything. Now, loads of these ones on diagnostic radiography will go across, but I'm not going to write them all again just because that would be boring. So I went over to therapeutic radiography and I looked at any extra skills that were on there that I didn't see on diagnostic to try and see if we can get into it a little bit deeper. So there's leadership on there, managing others and encourage them to follow your lead. That might be managing a patient or managing staff. Teamwork, we have that, liaising with colleagues, patients, creating treatment plans, just making sure you've got a productive working environment. Conflict management was one that was on therapeutic radiography. Now, people are under tense situations in these jobs, so I'm not suggesting at all that it's a hard working environment. When people are emotional, sometimes things can become tense, and that is a real skill to keep people calm. Okay, and innovation, thinking of new ideas, suggesting and implementing fresh new ideas for your department, and you can cross those skills across both job roles. But what I really want to say to you at the end of this is, you might be applying for it, you might think, I really want to go into this. When you're applying to courses, you won't have that experience to say, I've made treatment plans, I've used this technology, but you will have all of them skills from school, from your personal life, from any extracurricular. You'll have communication in all your lessons. You might have a real interest in technology. You'll have to plan your life. So always, whenever you're applying for anything, don't be put off by things like that. You've got all them skills. You're that person that they're looking for. You just need to think, how can I show that I've got them skills? Look to your school life, look to your home life, look to your extracurricular, look to clubs, anything at all. Okay. Now, job spec for a person who's applying for the NHS. Not only do they have to have the skills, the knowledge, the right type of person, they also have to show that their NHS values, that their values meaning how you think you should behave in life, match the values of the NHS. Now you can see the 6 values across the top there: working together for patients, respect and dignity, everyone counts, commitment to quality of care, compassion and improving lives. When you're making any application to the NHS, you need to show that you've got all 6 of those things in your life. You show people respect and dignity, you work together, everyone counts. Now, I'm not going to go into that into too much detail. We've got a whole session on it. If you go back onto our website and look at the session that we did on dietics and dietics and speech and language therapy, good memory there, you will see a whole session on the NHS values that you can view. Or you go to slide 3 of your pre-work and we've got a whole workshop for you to do there to get au fait with the NHS values. But it's essential if you want to do anything in the NHS to know them like the back of your hand and show that you share them. So very last, to help you with the NHS values, to help you with your skills, to help you with any health care careers, we offer one-to-one mentoring to support your pathway into a career within health and social care, and that is within a 12-month period. So you're now part of the Creating Careers family and you can access that. I want to know, are you interested in that? It's not about, we're going to meet you in person, I'm going to be saying, hello, come on, let's do some work. It's just about giving you a little bit of support on your terms in a way that makes you feel comfortable. It could be a regular email or whatever makes you feel comfortable. So are you interested? Yes, not sure, no. Let us know your feelings. And if you are interested in that, get in touch either on the chat, Google Classrooms, or the email that sends you your pre-work, and we can arrange that for you. So I have to apologise. Oh, I'm loving this. Over the last few, we started off and a lot of people were saying no, and now over the last few weeks, we've had yeses and not sures. So all the no's have gone. I'm really, really pleased with that. So all you yeses, get in touch with us and we will get the ball rolling on that. All you not sures, get in touch with us and we can talk about it. And if you don't want to do it, you don't want to do it. But the offer's there. It's absolutely fantastic offer. So I'm only 3 minutes over. Apologies. But we are now going to hand over, I think, to Chloe, who's going to interview for today's session. Thanks, Chloe.
Hello everyone, thank you Leslie-Anne. So that was really interesting actually. I think it was great to hear you guys talk about the transferable skills that you may need to come into some of these roles and delving a little bit more into what they actually entail and what it's like to be in those jobs. So we're now going to hear a little bit more about what it's actually like to be working in these roles as we speak to our ambassadors. So just to say a little hello first, so I'm Chloe and I'm from the GM Health and Social Care Careers Hub. So we work with all of the NHS trusts in Greater Manchester, as well as social care providers as well. So we're here to support you with any of your information that you might need about the different roles within health and social care. And so that's why we're involved with today, to ensure that you guys are starting that knowledge and information around both diagnostic and therapeutic radiography. So without further ado, let's talk to some of our ambassadors who are going to talk to us a little bit more about their roles. So I believe the first person that we have here is Caroline, who is a diagnostic radiographer. So Caroline, if you want to make yourself known,
Hi,
that would be great.
We don't have a video, we've only got a microphone, if that's okay.
Yeah, no problem. That's no worries.
So I'm Caroline and I'm sat here with Katie. We're both actually on shift at the moment and we're both diagnostic radiographers.
Fantastic. So hello, both of you. And as we go through this, if anyone's got any questions, please just pop those in the chat and we'll ask anything that you guys want to know as well. So yeah, welcome both of you. So I suppose to begin with, are you okay to give us a little bit of an overview about your job and what it entails?
Yeah, absolutely. So as you touched on earlier, we are responsible for producing images for our patients that will assist in diagnosing any illnesses and injuries that they might have. So such as x-rays, CT scans, MRI scans, ultrasound. And we also produce these images. We also go to theatre. Actually, I wanted to mention that as well. We also actually work in theatre with the surgical team to make images there. If anyone's having any metalwork put into the body, for example, we use x-rays up there to check they're in the right place. And obviously part of our role, it's really important that we ensure patients are being really well looked after. We are in a healthcare profession. We have to make sure our patients are looked after, they're comfortable, they feel safe and reassured. So it is important that we do have that empathy and, you know, kind nature as anyone would want for themselves or any relatives that are in a hospital being looked after.
Yeah, that's great. It's really interesting what you said about theatre, actually, because I probably hadn't really thought about the fact that you would do that work. So I don't know if you just want to explain a little bit more about what you do within theatres.
Yeah, it was before I even thought about this career, I didn't realise either. But for example, say you broke your wrist and the consultant you were under decided that you need to have a plate put in or any screws put in to keep the fracture stable so that you can use your wrist in the future. When you're in the actual operating room, there will be a radiographer present with sort of a mini x-ray machine, and they'll just take images throughout the procedure and just make sure those plates and screws are in the perfect position and the surgeon's happy so that the patient would have good use of the wrist. And it's the same with anything else. If you broke your ankle and you put screws in there, it's the same thing. But it's not something that people, I think, realise, because I didn't even realise myself until I got into this.
Yeah, no, I wouldn't realise that either. And so do you work in as radiographers? I know you may not personally, but people in your role. Do you just work in hospital settings or can you work in different settings as well?
So we're in the hospital right now, and we work in A&E, clinics, all the different areas, theatre, like I've just said, but we do also work out of the community. So for example, in walk-in centres, some walk-in centres have x-ray rooms there. So we do also work out in different places as well.
Oh, that's interesting. Again, I think when you think of diagnostic radiography, you think of the hospital, don't you? And sort of, you know, if you break your arm, that's where you go. So it's quite interesting to hear about some of the different areas that you may work in.
Yeah, definitely. We do work in all different places.
Yeah, that's great. So I don't know if you want to tell us a little bit more about how you got into your role, you know, what qualifications did you do? And feel free, I know there's two of you in the room today.
I'm just going to hand over to colleague Katie for the next one. This is Katie.
Hi, my name's Katie. I work with Caroline. So we both did a very similar path to get into this career. Obviously, we did our GCSEs and then did our A-levels. And we both actually did biology, chemistry and maths A-levels, and then both went on to study diagnostic radiography at Liverpool University. That's not to say you have to do those A-levels, but it is worth looking into if there is specific universities you want to go to, because, for example, Liverpool do specify that they want one science subject, but not everywhere is the same, so it's worth looking into. And also to get onto the course at Liverpool, they ask that you have work experience in a hospital or that you've at least visited a radiography department. So we both volunteered in different hospitals. I volunteered in Aintree and Caroline volunteered in the Royal, which was really good to give us a bit more experience of what it is like to be in a hospital environment and around patients who obviously are poorly and might be slightly anxious. And that helped build our communication skills as well with a variety of people.
Yeah, definitely. And I mean, you spoke then about how you both did sciences for A-levels. Now, in terms of what people might be interested in before, you know, in school or college at the moment, do you think this career is only for people who are interested in science, or do you think it may appeal to other kinds of people as well, if that makes sense?
Yeah, of course. I think friends that I had at uni did really varying A levels. Some did psychology, some did ethics. I think for the career, we do use certain aspects of biology and maths and things, but it's definitely not at a level where you need to do it for A level. I think the main thing is that obviously you're a caring person and you want to help people and look after people. I think that's more important than what A levels you do, if that makes sense, if that answers the question.
Yeah, so it's more about kind of, I suppose you wanting to work within this kind of profession, isn't it? You being interested in helping people, supporting people, rather than being really interested in like the technical sort of science side of it.
Yeah, definitely. And I think once you're in the career, there is avenues that you can go down if you wanted to get more into the science area, or if you wanted to get more into the patient-based area. It's a really wide career. So there's options either way. It's just that people are aware that certain universities do request certain A levels. So it's just to have a look into that before you make choices if you've still got time to.
Yeah, and it's all about doing that research, isn't it? Because each university may have different requirements, so it's worth kind of having a look into things. So if you have already taken your A levels and you're worried because one university asks for you to have done chemistry, for example, then don't panic, because another university might not ask for that. They may just ask for a science. And also universities categorize sometimes science differently, which might not make sense, but there's some subjects that are on kind of the periphery of science that some universities include and others don't, if that.
Yeah, no, I agree. That's why it's just good to look into it. But I think you don't definitely have to do them to be able to do. You definitely don't have to do all science subjects to be able to do the job. Not at all, no.
And what was the course like then? Did you do bits of work experience while you were on your course, or was it mainly kind of theoretical based learning?
I think again this varies from university to university, but the way the course was ran when we were there, which was 5 years ago, obviously you started in September with some theory, and the practical side of it then followed in the November. So you'd only been in uni about 2 months before you were first out on placement, which was really, really interesting, I think, to have a look at some of the basics and get used to even shouting patients from the waiting room, or getting used to how you speak to different patients, because the hospital we're in, there's newborn babies up to very elderly patients. So obviously that requires different skills as well.
Yeah, definitely.
And then, sorry, I just wanted to, as you go through, so the first year you don't have as much time on placement, the second year you have a lot more, and by third year we only had 6 weeks in university and the rest of the time was on placement.
So it sounds really hands-on then.
Yeah, which is really good, because I think it's good to get your head around the theory, but it's then nice to get the hands-on experience.
Yeah. So I don't know if either one of you wants to tell me a little bit more about kind of a typical day. I mean, I'm guessing every day is different, but if you just want to describe what a typical-ish day may look like for you.
Yeah, so as you just said, every day is different. First of all, we work different shifts. So sometimes we'll work an extended shift and then get more days off for it. We'll do an early shift, a late shift, weekends, nights. So whatever shift you're doing, there is a very different feel to the shift. We, as I said earlier, we work in A&E, we work in the clinics, walk-in centres, and we also meet, as Katie said earlier, a wide range of patients. We literally image newborn babies up to obviously the very elderly and everything in between. We also work a lot with students, obviously because we have our own students who are here on placement with us. Part of our role is to train them while they're here with us, and also at the forefront of our minds a lot is our patient safety. We have to make sure that our patients are safe at all times when they're with us, that they're being properly looked after, that they're getting the correct images, and making sure that images we produce are diagnostic. So we have to make sure we're working at a very high standard.
Yeah, that's so interesting. And I suppose you kind of spoke about it then, but it'd be really interesting to know, I suppose, how you work with other people within the hospital. I know allied health professionals are normally very kind of, you're working with lots of different people all the time. So I don't know if you can explain how you work with other professionals a little bit more.
Yeah, definitely. So obviously anyone who is able to request an image, such as a doctor, they give us the clinical information about their patient, and then we obviously decide what images that we have to take. And sometimes we do different x-rays for different things. For example, when we're in theatre, we're working with the surgeon, we're working with the operating department practitioners, which is another allied health professional that you can go into. No matter where we are, we're always working with different people. If we go to x-ray patients on the ward, sometimes they're too poorly to come down to us to have an x-ray in the department, so we take, again, like a mini machine to them, and up there we'll work with the doctors, the nurses, physios even. We do meet a lot of different professionals while we're here.
Yeah, I bet it's so interesting as well, because I suppose you're one piece of a much larger puzzle. So I bet it's quite interesting to see how that kind of feeds into, you know, what happens next after you've done that diagnosis.
Yeah, absolutely. And we all the different professionals, we all play our part. I mean, sometimes you'll x-ray a patient in A&E who's broke their foot, and then you'll see them a few weeks later in clinic with like their plaster on, you'll x-ray them again. And so it's nice to sort of see the pathways and see that everyone's making a difference to that patient.
Yeah, so is it often then that you see the same patient a couple of times, or is it that more often that you would take the images and then kind of they're off, if that makes sense?
It varies, really. It does vary. Like I say, sometimes it's a bit of potluck. Sometimes I have x-ray people in A&E when they've unfortunately broken a bone, and then I'll have seen them quite a few times when they're in clinic having the treatments and follow-ups and treatment plans. But it is pretty much luck, really. But it is nice when you get to see patients again and you can see how they're getting on, especially if you saw them after an initial accident or something, they weren't very happy.
Yeah, I bet that is quite interesting. I just wondered if you've got any advice for students if they're interested in this area of work, and kind of what would your advice be to young people to help them kind of get into diagnostic radiography?
Yeah, definitely. I would say to try and do some voluntary work in a hospital setting, even if it's not specifically a radiography department. I think, like I mentioned before, it's really good for your confidence, even speaking to different people, getting used to a hospital setting, because you may have been there as a patient, but as someone who works in the hospital as part of, like you've mentioned, a bigger team, it's really interesting to see how everything comes together. I would try and visit a radiography department if you can, even if it's just for an afternoon or a day, just to see how it works, because our department isn't necessarily one you'd have experienced unless you've had an x-ray or a scan, and obviously that is different if you're on the patient side of things. And just try and get your confidence up with communication skills and getting used to what a busy hospital environment could be like.
Yeah, definitely. I think it's really interesting what you said then as well about just getting kind of any role within a hospital. And I think that's really key, because I don't think you often realise how much different departments and stuff talk to each other, and how just being in that environment is so interesting, isn't it? To see kind of everyone doing their own little bits, and yeah, I think just kind of being exposed to that is really useful, isn't it?
Yeah, definitely. I mean, my volunteering in Aintree A&E, which is a major trauma centre, so it's big A&E, was literally making cups of tea and coffee and taking it round to the patients and the relatives. And the amount of different stories and experiences I gained from that definitely gave me more confidence when I'm then speaking to patients in my role as a radiographer.
Yeah, that's so interesting. I think those communication skills are so important. I know we spoke about it a bit before with the transferable skills, but I think that's one of the skills that is hard to teach theoretically, isn't it? It's you've got to kind of learn it yourself, I think, a little bit, communication.
Yeah, definitely. And seeing how people respond when you do say certain things, or how appreciative people are just for you stopping and being able to have a little conversation with them, it makes a massive difference.
Yeah, that's great. Well, thank you both so much for chatting to us. I can see there's Oh, I think there's a couple of questions come through in the chat. So I think you guys are okay to stick around, aren't you, and sort of answer some of those.
Yes, of course.
That's great, thank you. And we're going to go over to our therapeutic radiographer now, but I suppose if we've got time at the end, then you're welcome to pop back up again and answer some of the questions vocally if you like as well. But yeah, thank you both so much. That's been so interesting and really great to hear a little bit more about what you do and how we can get into that role as well.
Oh, thank you. Thanks for having us.
Thank you. So yeah, if you do have any questions for those two, then please do feel free to keep popping those in the chat box. They do have their eye on it. But I believe that we now have Alexandra with us, who is a therapeutic radiographer.
Hello, can you hear me okay?
Yes.
Oh, lovely. Hi, I'm Alexandra. I'm currently working at Classic Bridge Cancer Centre in Liverpool, which is a fairly new centre that's opened in the past year. I'm working as a Band 5 radiographer at the moment, and I have been here for about 4 months. So I'm very newly qualified, and it's my first job since university. And I haven't trained here, so it's a brand new working environment for me. So I'm just about settled in. So radiotherapy, I'd say our main job here is we are from the process of planning patients to treating patients with cancer. So we don't do all the jobs at once. Some of our staff are stationed in planning, which involves taking a CT scan of our patient in a particular position with a particular equipment. We have different, what we call a mobilisation. So the patient has to lie on the bed the same way for planning and treatment to ensure that the anatomy is all in the correct place. So we have certain staff that do the scans. These scans then get sent off to our planning radiographers, who alongside the oncologist create a specific plan for the patient on how they're going to deliver the radiation to the tumour. This can be very complex and can take a while, and many people are involved in creating this plan because it's to a millimetre of accuracy for the tumour. And then that plan gets sent along to the treatment radiographers, who deliver that plan every day to the patient.
Yeah, that's great. That's so interesting. So you said at the beginning then that you're newly qualified. So how was it, I suppose, going from university study to being in the role? How was that transition?
It's been very strange, to be honest.
Yeah.
I didn't train here, so they're completely new hospitals to get used to. It's been lovely. People here are absolutely so supportive, and there's a very good crossover between finishing studying and starting. And there's definitely a lot of focus at the moment on preceptorship and mentors in hospitals and being heavily supported in your role. It's also very strange now being in that position where we are a teaching hospital here. So I'm now teaching students, even though I've just finished, and that's definitely been really interesting.
Yeah, and I know that in some other roles, and I'm not sure whether yours is similar or not, but once you've become newly qualified, you often kind of rotate around a little bit into different positions. Is that what happens for you, or are you kind of in a fixed sort of role now?
So no, we do rotate a lot. At Classic Bridge, we have got 2 satellite centres. So we have a centre in Liverpool, in the Wirral, and in Aintree, and we do alternate between those and have different months to get used to different machines, different staff, and just to get a bigger experience really and get used to that. At the moment, I've been on my machine treating for about 4 months, but we do tend to get put into planning to get used to that, and also on the CT scanners.
Yeah, so do you use then different types of machinery in terms of radiography?
So the base of the machine is, it's called a linear accelerator, but we abbreviate it to a LINAC because it's a bit less of a mouthful. The LINAC delivers photon radiation, which we use for the majority of our treatments for different cancers. We can have any cancer on our machine to be treated. We have breast cancer, lung cancer, prostate cancer, gynae cancers, any of those. But we also have electron treatments, which are done on the same machine, but they're ever so slightly different because we are treating rather than internally, it's more externally. So we've got more skin surface based cancers. We also have what's called an orthovoltage machine, which is specifically for skin cancers. And we have a new proton machine, which is opened in Manchester, which offers different types of treatments. And that's predominantly being used at the moment for children who've got cancer.
So interesting. So do you learn in your studies then how to use those different types of machines?
We do, yes. So similarly to what the diagnostic staff just said then, first year is predominantly theory-based with observational placement, starting to build up those basic communication skills, getting familiar with the machine. And then once you get into second and third year, it's a lot more about putting that theory into practice, using the machines and delivering the treatment yourself under supervision.
Yeah, that's so interesting. And I suppose similar question to the diagnostic radiographers is where you work. I know you mentioned like different hospital sites. Is it mainly then in those hospital sites that you would be doing your job, or do you do any work in the community, or is it always like specialist cancer hospitals that you work in?
Yeah, we do work in just the cancer hospital itself, but between those 3 sites. The cancer hospital is very few and far between. It's not like general hospitals where you can have 6 or 7 in Liverpool alone. So we just have Clatterbridge here in Liverpool, and then the nearest one in the northwest would then be the Christie, which is in Manchester. So we have quite a large catchment area for Clatterbridge. We've got Warrington in Cheshire, Merseyside and the Wirral, up to Southport. But then once you go into the Christie, they're more Greater Manchester and Derbyshire in that area there. So some patients have to travel from quite far to get to us.
Yeah, I bet. And I suppose again, similar question, but how, because I'm guessing as well in terms of your role, and probably same for diagnostic radiographers as well, in terms of working with different staff members, do you also have to, as well as other clinical staff members that are kind of patient facing, I'm guessing that you also maybe have to work with maybe like engineers and people who work at the back end sort of side of the machinery as well?
Absolutely. We've got so many people we work with here at the moment. So yeah, behind the scenes, we got physics and engineers that are very key to what we do. In the morning, we have to do quality control checks on all the machines because it's very vital that the radiation is the correct energy, frequency, and it's coming out in the right directions because it's a very strong dose that we give to the patients and its health and safety. So we get the physics and engineers to help us with that. If you have any faults at all, they also come around to help us to repair the machines. In regards to more patient-facing roles, we're heavily supported by our support workers who are on the front desks, and they're involved with patient appointments, patient preparation and transport. We're also heavily involved with the oncologists if we need to review a patient, if something needs to be prescribed for them, we get in touch with them and they can come down and support us with that. We also have lots of patients, unfortunately, who end up being admitted over treatment onto one of our wards. So we have to liaise with the porters and the nursing staff up there in order to get them ported down for their treatment.
Yeah, that's so interesting. I think it's really great to hear about all the different people you work with because, you know, as well as clinical staff like yourself, there's also lots of other people behind the scenes. And sometimes I think when we're thinking about, oh, what can I do for the NHS that will mean that I have that, you know, patient contact or I'm making a difference, you know, obviously you all do a great job, but there's lots of other people as well who also are doing really great things. And it's not always people who are working in a more of a medical setting. Sometimes, like you say, you might be on the front desk or behind the scenes, also making that impact as well, aren't you?
Definitely.
I know you spoke about you'd been to university and obviously now you're in the job. What did you study kind of before university?
So I had a very mixed bag of subjects I did at college. If I'm honest, when I went into college, I didn't particularly know which direction I wanted to go into. So for my A-levels, I did biology, history and theatre studies, which is very mixed bag. I also did AS level chemistry. It took me quite a while to figure out what it was I wanted to do. I've always been told that I was a very empathetic person and thought, have you considered healthcare? My first question was whether I wanted to do diagnostic radiography, which I did consider and do a work experience day, a couple of days shadowing there. And I also thought about nursing and did a couple of days observation, also shadowing there. And what I figured out of my observations was my favourite parts were the technology side and the machines of diagnostic, but the patient care and relationships that were also in the nursing. And I felt that the radiotherapy really offered me both So I applied to do a day at Clatterbridge at the Wirral and at the Christie. I did 2 days observation there and decided that was definitely what I wanted to do, as well as asking all of my questions at open days, which are really important from lecturers. They'll give you so much information about what the course and the job actually involves. And I was pretty set on what I wanted to do then.
Yes, I suppose, would that be your advice then? Because I'm guessing that a lot of people on the call today are thinking, I know I want to work in healthcare, but I don't know where. So is that kind of your advice, that is maybe to do some work experience?
Absolutely. Some hospitals are very advertised that you can come to them, some aren't, but just contact people. I contacted a ward randomly at Wiston. I asked if I could go on there to have a look, and they were very accommodating and very enthusiastic to get students there. Equally, some of the teaching hospitals run certain educational days, so I went over to Leighton Hospital, and they had a clinical skills day over there for students in college, teaching them how to do very basic, like spinal taps and blood taking off fake arms. And that was really interesting to get some hands-on skills, to know that you were interested in healthcare. So definitely work experience and study days if you can get on them. And just considering your own skill set, what your strengths and weaknesses are, and what you think you can bring to roles.
Yeah, definitely. And for anyone who's maybe a little bit concerned, because I know at the moment work experience has kind of been a little bit sort of pushed to the side in the hospitals, is, you know, coming to things like this and hearing from people like yourself is really useful, I think, because, you know, even if you can't get that experience yourself, it's quite interesting to learn about what your role is compared to diagnostic radiography. And like you say, you can maybe try and think about how that relates to yourself and what it is you want to do. So yeah, just try and, for people who can't maybe get work experience at the moment, just try your best to go to as many different things as you can that will, even if they're online talks, you're still going to get stuff out of it just by listening to people and by hearing exactly what people do in their jobs. Definitely. What is I suppose 2 questions. What is your favourite part of your job, and what is maybe your least favourite part of your job?
Okay, so my favourite part of the job is we're very patient-centred. We can see a patient up to about 6 or 7 weeks at a time if they're coming for a curative treatment. And because we see them every single day for at least 20 minutes, you really do build a relationship with your patients. You end up knowing all about the families, the social activities, what they're doing, how they're getting on with treatments and different hospitals they're going to. And it's really lovely to be able to see them go from start to finish and support them along that journey. And that's definitely my favourite bit. We're also a very team-centred career. We are allowed to work individually because of the nature of the radiation treatment. We always have to have somebody working with us to check what we're doing. As a result of that, you're very highly supported and you're always working a team of radiographers, and it's a really good atmosphere in these departments. But I would say probably the most difficult part of the job is we are dealing with cancer as the nature of the job. And we do have some poorly patients who, unfortunately, we are giving treatment to for more of a symptom relief rather than a cure. So that can be particularly upsetting sometimes to see that. But at the end of the day, we do know that we're giving them this treatment in order to give them the best quality of life in the last couple of months. And we all are very heavily supported and look after each other. And it's a very worthwhile job to do, definitely.
Yeah, that's great, thank you. And I suppose the things that you've highlighted then are maybe some of the differences as well between diagnostic radiography and therapeutic radiography as well. I know you talked about like that constant patient kind of contact. I suppose diagnostic maybe not as much so, but also in diagnostic you may not be dealing with as many kind of poorly patients because I'm guessing for you as well it must be hard because you build that relationship with a patient and you're treating them as well. So I'm guessing it's quite hard to see people who you know quite well going through the treatment process.
Yeah, absolutely. I mean, over the treatment, they do also come with side effects. So we have to make sure we treat them for that. The radiation can cause some skin reactions, a bit of reddening. If we're treating the pelvis area, we can have changes in the bladder and the bowels that we have to give medications for and different pain relief. But whilst we're getting that sorted, you can tell how grateful patients are for your supporting them along the journey, and often those symptoms that you start to see, we get them under control and they're very grateful for that. And you can really see the progression throughout the treatment. So as much as it can be difficult sometimes, on the whole, I think people, when I first came across this job, I thought, I wonder if this is going to be quite emotionally demanding. But generally the patients are so happy when they come in here just to see a friendly face and to have that treatment that they're so grateful for. That it is a very positive atmosphere on the whole here. It is a lovely job to have.
Yeah, that's great. And that's quite a nice place to finish on. So thank you so much, Alexandra. It's been really, really useful to hear about your role. I don't know if anyone's got any questions in the chat for Alexandra or for Caroline and Katie. If anyone's got anything they want to know about either of the roles, please do pop them in the chat. And I know there's some kind of final bits for us to do before we finish. But if you've got any questions, please ask them now, because we're getting to the end of time, so I don't want your questions to go unanswered. So yeah, please let us know if you do want to know anything. But yeah, thank you so much, Alexandra, Katie and Caroline. It's been really interesting to hear about your roles and to hear the differences, because I think radiography sometimes is sort of like lumped together as one job when you're both doing quite different things there as well. I can see there's one question in the chat, which I'm not sure if it's been answered or not, for the diagnostic radiographers, just asking if you're trained in treatment at all, or if you're strictly kind of diagnosis.
Hi, so yeah, in response to that question, no, we're not trained in the treatment. We are trained in scanning to find the diagnosis. So that can either be X-ray, CT scan, MRI scan, ultrasound, and it can sometimes take a range of scans to find the diagnosis, but we're not trained in the treatment. That would be Alexandra's job.
Yeah, fab. Thank you so much.
Okay.
And yeah, I don't know if there's any more questions in the chat. Please do let me know. I think I can see. So sometimes on Zoom you can't always see all the questions. So if anyone else is getting anything put to them, do let me know. But yeah, thank you both. I'm not sure who's taking over next for the conclusion. Oh, Sarah, I can see you popped up.
Thank you so much, Chloe, and to our speakers as well. That was brilliant.
Thank you.
We're just going to really quickly go over some next steps so you know how the support you can access works. So hopefully you can see my screen there. So as I mentioned, this is recorded. It's going to pop up on the Liverpool City Region Careers Hub YouTube channel, so you can watch it back. And again, if you watch it back and you've got any questions, I know we've gone really fast paced through loads of these. Please do just get in touch and we're happy to help. Shortly after we finish tonight, you're going to have a email from my colleague Abby, who sent you the link for today, and that's going to have some really important content on it. The first thing is a post-work roadmap that Leslie Ann developed. If you've come to any of these before, you've already got a roadmap, you can carry on working on that one. But if it's new to you, this is essentially something that helps you to reflect on the session today, whether you can see yourself in those careers, what you liked about them, what you maybe would want to know more about them, and ultimately to help you make decisions a little bit further along the way. Or if you are ready for your university application or your apprenticeship application, so that you've started on those reflections that you can pull on when you're filling in those personal statements or those job applications. It doesn't take very long, and all the students who've done it previously and the students who did it last year have all found it really, really helpful. So we do encourage you to just spend a few minutes on that one. You'll also in there have a link for an evaluation. Now this takes 5 minutes. It gives us an idea of what you found really useful about today or potentially less useful, so we can improve future webinars. But you also, at the bottom of that evaluation, you've got the option to say that you would like one-to-one follow-up support. What that means is the Uni Connect for your region will get in touch with you, and they will talk you through individually whatever questions you have, whatever support you need, whether that's signposting on, answering questions, providing feedback, all of that kind of stuff. So please do take that up. It's something that you're offered as part of becoming part of the Creating Careers gang, so please do that. Last reminder for Google Classroom. It is really, really helpful, and we've had lots of feedback from students. We don't want to constantly email you loads of things that you might find helpful, because you'll probably block us because you'll think we're spamming you, but also things can get lost. So they all go on there, and then you've got the central repository. Again, It's not going to be deleted. It's not time limited in any way. So you'll be able to go back onto there whenever you need to, if you need a bit more information or you're ready to start progressing into your next steps. We would also encourage you to sign up to further webinars. So you have all seen this page. I know that you've seen it because you signed up for today on this page. And we have got webinars. We've got a little break now because of half term. They kick off again on the 10th of March and they're running all the way through to July. So there are going to be lots of different subjects that are covered. You can see all of them on here. Again, the link to go back to this, if you lost, it'll be in the email, but you can see all of the webinars that are available. And you can sign up for them. And we would encourage you to come to as many as you think you'll find beneficial. So although you might be really interested in one healthcare career and you're pretty set on it, it can be really beneficial for you to be able to come to a couple of the ones that might work adjacent to it. So if you were interested in, I don't know, physiotherapy, you might have also wanted to come to orthoptics or something like that. So that when you get to interview or application, you're able to talk really broadly about the different NHS professions and how they all work together. And that's something that students really asked us for last year and hopefully you'll find useful. And that is pretty much everything from me. Myself and Abby will stay on for a couple of minutes if you want to pop any questions you've got about the classroom, signing up for further webinars or anything like that in the chat. But otherwise, thank you so much for coming along tonight and we hope you have a really lovely rest of your evening. Thank you guys.